On June 12th, U.S. Senator Tammy Baldwin introduced the ENROLL Act to protect the Affordable Care Act Navigator program. And ENROLL is an acronym. It stands for Expand Navigators Resources for Outreach, Learning, and Longevity. The act would make sure the Navigator program continues despite the Trump administration cutting their funding by 90%. Navigators are helpers. They're created by the Affordable Care Act to help Americans navigate, shop, and enroll in affordable health care plans. They also conduct outreach and education. In the first Trump administration, Navigator funding was cut by 84%, and Senator Baldwin says that contributed to 2.5 million fewer people having access to a marketplace plan. Navigator funding was restored in 2021, and she said that got us on our way to having record enrollment by 2025 in the Affordable Care Act marketplace, with about 24 million people having health coverage. In February 2025, the Trump administration once again cut Navigator funding, this time by 90%, threatening to leave millions of Americans without critical assistance to access health care. Senator Baldwin's ENROLL Act would ensure Navigators have the resources they need, restoring funding to the program to $100 million annually, promote efforts to ensure Navigators provide public education and assistance that helps consumers, clarify that Navigators can also help people sign up for Medicaid, and otherwise do everything they can to make sure people aren't discriminated against for having pre-existing conditions. The ENROLL Act has a number of co-sponsors in Congress, and it also has support from a number of agencies, like the American Cancer Society Cancer Action Network. In a statement, they wrote, appropriately funding healthcare navigators is essential for making sure consumers, especially those with complex medical conditions like cancer, can get access to the most appropriate health insurance coverage that will meet their needs. You can read more on the ENROLL Act. We link to it in the description below.